engineers in FEMA. It's been really incredible. Nobody's seen it. They'll build hospitals in 2 or 3 days, portable hospitals. This afternoon, I invoked the Defense Production Act to compel General Motors to accept, perform, and prioritize federal contracts for ventilators. The ventilators are a big deal, and we've delivered thousands of them. And oftentimes you don't need ventilators very much. Hospitals don't have very many. And now we're turning out that we have to produce large numbers. But we've been able to do that, and we're going to be doing a lot more. This invocation of the DPA should demonstrate clearly to all that we will not hesitate to use the full authority of the federal government to combat this crisis. We thought we'd get to the bottom line, and quickly we will do what we have to do and immediately exercise all available lawful authorities to get the job done. This afternoon, I also signed an executive order investing, and very, very strongly investing, the Department of Health and Human Services and the Department of Homeland Security with the full authorities available under the Defense Production Act to respond to the outbreak of the terrible virus, the invisible enemy, as we say. My order also establishes that Peter Navarro, a very trusted person from the White House, and he's done an incredible job for me, also from Harvard. And he's a tremendous guy, and he will do a fantastic job. And I'd like to maybe ask, before I continue, Peter to say a few words, please.
Thank you, President. Of course, you know the Harvard joke, you tell a Harvard man, you just can't tell him much, right? So, anyway, on a serious note, let me just give you a little idea of the Defense Production Act and why it is so important. We are engaged in the most significant industrial mobilization since World War II. We have a wartime president fighting an invisible enemy, and we have the full force of government coupled with the full power of private enterprise bearing down on this problem for the American people, sir. What we had to do today with President Trump's order with respect to General Motors, I want to give you a little background on that. We need industrial mobilization to make adequate ventilators, particularly in the very short run, to help the people in New York, Detroit, New Orleans, Chicago, Denver, Seattle, all around this country as this virus bears down. And the ventilators really are the most important thing for patients who become most seriously ill. They're literally the lifeline for people. And I've personally been working with FEMA, blocks with GM. We cannot afford to lose a single day, particularly over the next 30 to 60 days. So President Trump invoked the Defense Production Act as a way of enhancing and accelerating this mobilization. I salute him for doing so. It's going to make my job so much easier. For the most part, we've had tremendous cooperation from the private sector. Today, sir, was the right day to do it. Thank you, sir.
The administration is marshaling the full power of the American government, and we will do that, and that's what we've done, and we will continue to do it until our war is won. Economic, scientific, medical, military, and homeland security, all of this to vanquish the virus. I also signed an executive order giving the Department of Defense and Department of Homeland Security the authority to activate the ready reserve components of the armed forces. This will allow us to mobilize medical, disaster, and emergency response personnel to help wage our battle against the virus by activating thousands of experienced service members, including retirees. We have a lot of people in FEMA. Any individual who is concerned that they might have the virus can now download the free COVID-19 app on their iPhone and answer a set of simple questions about their symptoms and risk factors. It's getting to be a very modernized system indeed. They'll soon receive HHS recommendations on what to do next, including whether they should get tested or not. And again, we only want people to get tested if we think they need it. In a few
quarantine orders, yeah, and they are intercepting people on highways, at airports. They say this is at the recommendation of your administration. Is that true? And if so, why doesn't
Well, I think I'm going to let Tony speak to that a little bit later, but we're being very strong on quarantine. We're being very strong on people not leaving, especially certain states, and going to other states where they have less of a problem. We're hearing constantly about people leaving New York and going down to Florida, and New York obviously is a hot spot, and that's why we're building all those hospitals in New York and all those medical centers in New York. So we'll let Tony answer that, but specifically, you have to understand, we're not playing games. John? Task Force, I'm talking about FEMA, the Army Corps of Engineers. There's no country in the world could have done what the Army Corps of Engineers has done and is doing. Now they're going in and building, literally going into hotels and renovating hotels. That should be for governors to do. That should be for states to do. We have the Army Corps of Engineers so teed up and so stocked up, and they're really psyched and they're incredible. And there's no games with these people. They're in there screaming, get it done, get it done. There's not like sitting around taking it easy. These are workers. These are incredible people. So I think much earlier. And he's developed some incredible theories, and all of that information is coming over here. A lot of it's already come. The data, we call it data. And we're going to learn a lot from what the Chinese went through. Our relationship with China is very good. We also talked about the trade agreement, but I must tell you, this whole invisible enemy has taken over the world. Nobody cares about trade. No.
Right now, we're watching from home.
I would say that you are a citizen of the greatest country anywhere in the world. And we were attacked like nothing that's happened possibly since 1917, many, many years ago. We were attacked. And we're winning the battle, and we're going to win the war, and it's not going to take, hopefully, that much longer. But we have to win the war. And I would say that they have a duty to sit back, watch, behave, wash their hands, stay in the apartment with mom and dad. They look like they're lucky to have you as a father. And just learn from it. But, you know, the young people have been tremendous. Some of them are very happy not to go to school. You understand that? Perhaps yours, perhaps not. But we have literally had no problem. But again, they should just sit back and be very proud of our country because we're doing it for them. You know, ultimately, we're doing it for them more than anything else, if you think about it. The other thing that's nice, and the one thing that has come out, and I learned this again, it was reaffirmed by President Xi last night in my conversation. The young people are really, it's an incredible phenomenon, but they are attacked, successfully attacked, to a much lesser extent by this pandemic, by this disease. Whatever they want to call it. You can call it germ, you can call it a flu, you can call it a virus, you can call it many different names. I'm not sure anybody even knows what it is. But the children do very well. It's almost the younger they are, the better they do. I guess the immune system is, sadly for some of us, their immune system is stronger. But actually, I'm very happy about that. But they have been attacked, for instance, the Spanish flu. And if you look at the H1N1, the swine, if you take a look at the swine flu, which was, as you know, not so long ago, that attacked very strongly young children, kids, middle-aged people, everyone. Age is a factor here, so your children should be in good shape. But just tell them to be very proud of the country, okay?
Just follow real quickly. Both the World Health Organization has recently, as today, and your own health officials have said that any treatments that we use for coronavirus should be scientifically demonstrated to be effective. But at the same time, you said that chloroquine, as an example, could be used in a cure very soon. So is the WHO and your health officials wrong on this point? So
hydroxychloroquine, which is supposed to be the better of the two, seems to have some good backing. We're going to see. Look, Governor Cuomo, we've given him 10,000 units. It's a lot. And they're testing it. It's a malaria drug. It's also a drug for arthritis. And it's phenomenal for those two things, as you probably know, especially for malaria. But we're going to find out soon. I hope it works. There are signs that it could be doing well. They are testing 10,000 units. It's a lot.
In so many places around the country. Secretary DeVos and Secretary Perdue are going to share some exciting news and progress that we made in feeding children who need nutrition assistance while schools are closed. The truth is many underprivileged kids would not be getting school meals, apart from the fact that as we stand here today, our administration has approved waivers for all 50 states to give them flexibilities to work with local partners to get meals to children that are in need, and also a nationwide waiver to allow parents to pick up meals. But what's most exciting
and teachers during this national emergency. My team and I are in contact daily with governors, state school chiefs, college presidents, superintendents, and local education leaders. We are quickly responding to their needs so they can do the next right thing for their students. Most governors have decided to close some or all schools in their states for a period of time. As a result, students may not be able to take federally mandated standardized tests this spring, and the president took action to make sure they didn't have to. We made the process to delay these tests for a year fast and painless. As of today, 47 states have requested the delay or the waiver, and 46 have been approved within a 24-hour period. We also released additional information making clear the expectation that education will continue for all students. The transition to distance and online learning needs to happen quickly, and it needs to include meaningful instruction and supports for children with disabilities. Learning should not stop or be denied because schools fear federal regulators or fear doing something different. Distance learning is happening. States like New Hampshire and Florida have implemented phased and tiered approaches to meet the needs of students in their states. Other schools and states are implementing creative approaches and working through practical realities to help students continue learning. In remote Colorado mountain towns without internet connectivity, teachers are putting weekly learning packets together, and they're holding office hours by phone to help their students when they're stuck. South Carolina is deploying 3,000 buses with mobile Wi-Fi hotspots to help kids in remote areas access learning that way. This national emergency gives all of us an opportunity to come together to educate all students out of principle. It's simply not an acceptable option to educate none of them out of fear. So we stand.
That's happening out there. I want to mention one other simple but very important point about another matter that your listeners and readers may be very interested in. That's the food supply chain. USDA obviously is intimately involved in the food supply chain. We've worked with all those producers, even the ones who provide equipment and materials for our farmers and cattlemen and producers out there to make sure they have what they need. They're part of the critical and essential workforce there to continue. And the good news is those folks are staying on the job. Those who've grown it, those who are processing it, our inspectors who are grading it just the same way they always had. Those folks who are delivering it, packing it, delivering it, stocking those shelves, and checking out those customers. That's the great news about our food supply chain. And it's a great American story, Mr. Vice President, under your leadership, the President's leadership. This is that whole of America approach. Federal government can't do it all. We got great partners out there in the food supply chain, as well as our food nutrition services and our partners in our school nutrition services doing a great job to continue to get these meals to kids there. Two of our private sector partners are here with us today. I'd like for them to tell their story because it's a great story. Denton McLean with McLean Global here is partnered with Baylor, a collaborative on poverty and hunger, along with PepsiCo, in order to pack 1 million meals a week to deliver to rural kids who might not get to town to these drop-off sites where the other kids are picking up meals. And again, Near and Chaudhry at Panera Bread, CEO of Panera Bread, their company is also participating in Columbus, Ohio, with the Children Hunger Alliance there to deliver food meals that meet the regulations of USDA under flexible conditions there to get food meals there. And Panera's looking to expand that to nationwide as well. So, Denton, why don't you come and tell us your story? Thank you very much.
Our large cities and the enormous challenges that they face. But imagine this. You live in Iberia Parish, Louisiana, or you live in the Nome Borough in Alaska. Your schools are closed, and normally your children get 2 meals a day at school. Both parents are working from home, but mom and dad just can't get to town where meals are being offered for pickup. That's about to change and change for the better. Because of this USDA program, McLean Global will source, secure, receive, organize, assemble, package, label, and then deliver boxes straight to a child's home. And here's another big difference. For the first time, we'll be able to offer shelf-stable meals that will last 2 weeks. That's a true game changer for rural families. It's happening because of the president's order to do whatever it takes to get the job done. Everyone knows that tons of paperwork can be like lighter fluid for a great idea. And this is a great idea. We field tested it in 2019 and it worked. You've heard today about the administration's work on this project. Here are some other important partners in this effort. We have Baylor University that will provide sponsorship and oversight. In addition, we are deeply appreciative to UPS and the United States Postal Service, and we are joined by PepsiCo Company to help get this accomplished. Because of this collaboration and our tireless employees, I can report to you the boxes are ready to ship. And after all, this is all about the children and who must be fed during this crisis. We stand ready to serve. Thank you, Mr. President and Mr. Vice President, for caring about the specific needs for the children who live in rural America. Thank you.
Today, we are announcing a partnership with USDA and Children's Hunger Alliance to serve freshly prepared, wholesome meals to children in the entire state of Ohio to begin with, and hopefully after that to expand that program across many other states.
Up on some of the questions that you had earlier. So the issues that we discussed with the modeling yesterday was to ensure that the models were adjusted for the great work that every citizen is making in doing the mitigation efforts, and to see if that was reflected in the request specifically for ventilators. And so we wanted to make sure that with a limited number of ventilators and the issues that we saw in Detroit and Dearborn, in Cook County, and now in New Orleans, that we were balancing and projecting correctly based on both what the models had predicted and then whether they were adjusted for the incredible mitigation work ongoing in New York City. We understand that this week and next week will not reflect that mitigation, whether it's New Orleans or whether it's New York and the New York metro area. We know that the hospital admissions that we are seeing this week and next week will be infections that occurred before the mitigation started, but we wanted to make sure going forward that the needs reflected that. That was what was adjusted in the Ferguson model for the UK, and I know you're following that very carefully. They believe strongly that the mitigation methods that were put into place that informed our mitigation methods, we all were working off of that same model, and I want to make it clear that those models, those flu models, have been incredibly helpful to really predict what would layering of these different mitigation methods, from social distancing to staying home if you're sick, to staying in that household, to have quarantine everybody in the household if anyone is positive. Now, there are other countries that took different approaches, and I want to be clear because we did hear from both China and South Korea, but it's always important that you adopt and adapt it to your community and the reality of your country. We do this around the world. You can't ever just take an off-the-shelf approach and then put it into action in your community. You have to understand your communities. And so although both China and South Korea removed people who were positive from their households and segregated them away from their families, we did not think that our Americans would adopt and adapt to that situation. And so that's why in our guidelines we asked people if there is a family member to try to self-isolate in the household and so that that person is still there in the household. So I just wanted to be clear that, yes, we all heard about what China and South Korea did. as much as we could. We adapted them to the American situation, as the UK has done also, and we just wanted to really ensure that all of the requests for the stockpile reflected the great work that the American citizens were doing in each of these areas to ensure health. And then finally, there was a question about requiring quarantine. I want to make sure that everyone understood when we talked about New York residents who had gone to other places, it was for them to voluntarily self-isolate and take care of themselves because we felt like they could be exposed. And we really wanted to alert them that the rates in New York City were high and were increasing, and that they were probably exposed during some of the most exposure time period before the mitigation efforts went in. So this was really about the health of our New York citizens that then chose to go to other places, both to protect themselves and to protect others. So hopefully that's clear to everyone about those issues. We continue to look at the data every day. We really want to applaud the laboratory testing that is helping us. It will help us very much when we can get full surveillance up in many of our communities and surveillance around those most vulnerable, particularly in nursing homes and long-term care facilities, so that we can more rapidly test both the workers and the occupants in those communities. Thank you.
Thank you very much, Mr. Vice President. Today, just a few hours ago, I had the opportunity to get on a telephone call with the people who are on the front lines, the people who are actually in the ICUs or in the hospitals from all of the areas that are being hardly hit, including New York. And I'm not a supply person. I'm a physician, a scientist, and I do vaccines and I do drugs, but I am a member of the task force, and I do take very seriously the responsibility that we have to those individuals to get them the material that they need. We've heard discussions about this, ventilators, personal protective equipment, masks, and things like that. They are doing an amazing job up there. And I just want to have a message to them, which I told them over the phone, that as a member of the task force with my colleagues here, we're going to do everything we can to make sure that they get everything they need at the time that they need that, because they are doing an amazing job up there, and I salute them. Thank you.
Great. We'll take a few questions.
Just a quick one to Dr. Burst. I asked you about 8 or 9 days ago about the data for all these tests, and you had suggested that there would soon be a website where we would see all the data. Are we closer to that? When do you expect that? Do you have any data to give us tonight? As far as I can tell, this has not been publicly released yet.
Yeah, no, thank you. I've learned, as Tony has described, we've learned that when a community is educated, we all do better together. And so it's important to get that information out when we start talking about where the virus is, what the percent positives are, and really inform communities so that they can make decisions, so that people can take protective measures for themselves and for their families. And I find that it's important, yes, for us to have the data, but it's equally important for the state and local governments as well as the community. We are still, because we worked very hard to get it into the first bill, but it was changed to state and local labs, and obviously 95% of all the tests are being done in the commercial labs. So in this recent bill that was just approved, it is mandated that all commercial labs need to report. And so you'll have that data when we get the data comprehensively from all the commercial labs. But it was passed today, so hopefully we'll expect it tomorrow.
The testing standard here. You're going to need to test people who are well, or only people who are symptomatic. Obviously, let's say in Omaha, 10 people walk into a hospital, 5 come in, they're all tested positive, 5 go home, they may still be positive. What is your standard in order to make these recommendations?
So I'm glad you asked, because the important thing about testing, it only tells you if you're positive or negative that day. You could become positive the next day. And so testing should be used intentionally as a surveillance tool or a diagnostic tool. And I think what we're going to work on over the weekend is to weave together both a testing strategy for surveillance, which you brought up in that key point, while maintaining a strong testing for diagnosis. Because our first obligation is still to ensure that patients get diagnosed, both so that the personal protective equipment for those who are negative doesn't have to be utilized, but also to give those patients the opportunity to have optimal care. And I think Dr. Fauci mentioned this a few minutes ago. The things we have learned over the last just 3 months was a lot of information about how best to ventilate patients. I think that has been shared across communities and across clinicians around the globe. We never previously had an experience where a lot of people had to be ventilated prone. So this kind of information that has been shared has been critical to improve the survival of the patients that we have in the United States of America. And we really want to applaud the countries who've been giving all of us that information and sharing it across the clinical network.
Dr. Fauci, Sunday will mark 1 month since the first death for this new disease. I want to ask you a bit of a philosophical question. I've known you for 25 years. You've been through HIV, AIDS, MERS, SARS, West Nile virus, Ebola, all of that. How has this nation changed since that first death 1 month ago?
Well, this is truly an unprecedented situation that we're going through. As you mentioned correctly, John, I have been through everything from the very beginning of the very uncertain days with HIV/AIDS. Cumulatively, if you look at what's happened with HIV/AIDS over the 38 years that we've had it, the burden and the suffering and the death has been enormous, historic. But it came over a period of time. There was a fight in the beginning. What we're seeing now, in actual real time, is something that's unprecedented. This is something that we have never seen before, at least in our generation. They've seen something maybe like this back 100 years ago, and we're really being challenged to not only learn in real time, to be able to respond in a way that is helpful and effective, but we're also in uncharted waters. And I think that's the thing that I find different, is that the waters are uncharted, so that it isn't as if we have an example of how to do it. We have an extraordinary confrontation on the health and the welfare of the globe, particularly for us here in the United States. So as somebody who's been through all of those outbreaks, this truly is unprecedented. So from the first day to now the first death, we've been through something that no one has ever experienced in our generation.
Let me say good evening to each one of you. I trust this was helpful. We'll continue to keep you informed. Over the course of the weekend, the President will be traveling to Norfolk for the embarkation of the U.S. Navy ship Comfort. Our task force will be meeting through the course of the weekend, and we'll be reviewing the data and preparing recommendations for the American people going forward. But thank you all for your time and attention.
Secretary Perdue.